We have three primary messages that we're asking the members to deliver to Capitol Hill while they're here for the annual meeting. The first is that hospitals need to tell the positive story. They need to share the great work that they're doing. Obviously, the headlines with healthcare costs and the Affordable Care Act and other things tend to focus on the problems of the system. We've got to fix those. But we're doing such great things in improving care, safety, patient satisfaction, coordination. We've got to tell that story. Number two, hospitals need a predictable partner in the federal government. Some 60% of our revenues come from Medicare and Medicaid combined. We need government, frankly, at both levels, to be a more predictable partner. And we'll be talking to the Hill about that. Blunt cuts, unnecessary regulations, things that get in the way of coordinating care really all have to be addressed. The third and final message is we need their partnership and help to care for the most vulnerable populations in our communities. The dual eligibles out there, the poor, the disabled, the homebound. We need their help in focusing on those most vulnerable and, frankly, those with the least voice in the political process. The reality is that not that many seats in the House, Republican or Democrat, are really up for grabs in play. The Senate side, everybody's watching to see if the Republicans take control of the Senate, but they will not take. They will have the majority, but they will not have full control because no party is going to have 60 votes. So it'll be important if the Senate flips Republican. We expect the House to stay Republican, but you still have a president with 2 more years. So the Congress might be more active. It might be more unified in some ways. It might be able to agree more coherently to work with the president. The president might be in a position to do a deal with the majorities. Sometimes divided government is most effective. But we don't expect the elections to significantly alter the balance of power here in Washington. I think hospitals are always going to be an essential part of the healthcare system. Their focus, their mix of services, their configurations are going to change. But unfortunately, illness and death are inevitable. And so we're going to need a focus on a part of the system that handles the acute episode. Now, they also have to move out from that definition, pre-hospitalization, post-hospitalization. So there'll be a lot more community-oriented services, a lot more ambulatory services. But fundamentally, the core of the hospital, for better or for worse, is going to continue to be that focus complementing a health orientation and a health management orientation as well. I'm hugely optimistic about the future of hospitals. It's really just a great opportunity and a great time, as our chairman said last night in his investiture speech, for leadership in the hospital field. Our communities really do support hospitals. The H on the highway is an incredibly powerful brand. Many hospitals are moving in ways that are partnering with patients and communities and really responding to the forces that are out there with true leadership. So I couldn't be more positive, and I tell all the young students that I meet, this is a great field, it's a great future, and our entities will always be there to serve our communities.